Hi guys, it's your girl Eva Storm XOX. It is October the 1st. It is 11:57 in the morning, almost noon. I just kind of got up. I'm getting my butt to the gym. Normally I'd go a lot earlier, but it's my day off and we were a little bit busy yesterday doing kind of like a fun little date. Took a little bit longer than we were planning, didn't really make it to the gym. So I'm actually gonna try and bang out 2 workout programs today. I'm gonna do day 16 and day 17. These are technically the last 2 days of my program this week, but I'm gonna pump them up earlier and then put the other 2 after this. Just because they're a little bit shorter, but they are my heavier lift days and I've had some good rest, so I wanna make sure I can lift my heavy weights right now. There's also less exercises for these days, so it'll be easier for me to combine 2 workouts there. But I didn't quite have a first meal yet. I'm gonna actually have 20 grams of Crispers and I'll have my little protein shake there as a first little pick-me-up for the gym. So not quite fully fasted, but a little bit of a lighter stomach for my workouts this morning, and then I'll come back and have my proper meals. So stay tuned guys, we'll catch you in the gym. Bye! Alright guys, time to head into the gym and hit day 17 and day 18. So catch you guys in there. Bye! Training with a rotator cuff injury or pain requires modification and professional guidance. You want to focus on gentle range of motion exercises and low weight. But keep in mind doing high repetition strengthening while avoiding overhead motions and high impact activities. It is crucial to consult with a physical therapist or doctor if you're experiencing a rotator cuff injury. You want to then personalize your program and make sure you just stop if you feel pain, but limit the type of overhead exercises you're choosing to do, as lateral and overhead movements are what tend to irritate the shoulder. Now, what to do next? Focus on gentle exercises such as pendulums, passive range of motion exercises, and wall walks to regain movement. You're then going to want to strengthen with low resistance exercises. That means using light weights or resistance bands, aiming for higher repetitions of 10 to 15 reps and multiple sets, but not to the point of pain. Incorporate scapular stabilization, exercises like A's, T's, and Y's performed lying on your stomach to improve the muscles around your shoulder blades. You can also consider modifications like using a towel stretch for the anterior shoulder or performing isometric holds for adduction and external rotation. You can start with basic compound exercises in a modified way, such as dumbbell floor press instead of bench press to reduce shoulder stress. Then you can gradually increase intensity as you heal and strengthen, but pay close attention to pain signals which indicate overexertion. Moving on to things that you should avoid. So you want to avoid overhead movements. Avoid overhead lifts, pull downs, behind the neck, and upright rows, as these can put significant strain on the rotator cuff. You should also avoid high-impact activities that involve high-impact jarring motions. That should be avoided. Also be mindful heavy weight and complex motions. These can further cause damage. Focus on proper form rather than lifting heavy. Bench dips are also another one that puts a lot of pressure on your shoulder. This exercise puts the rotator cuff in a position where it can get pinched, so it should be avoided. Make sure to listen to your body. If an exercise causes pain, stop immediately. You may need to modify the exercise or lower the resistance. And remember guys, be patient. Rotator cuff rehabilitation can take a significant amount of time, sometimes 3 months or longer, so consistency is key. Baby your shoulder and please take care of yourself. Some gentle exercises for pain relief of your rotator cuff. So let's talk about what is the pendulum. So you want to let your affected arm hang down while you bend at the waist. Gently sway your body to let the momentum swing your arm in small circles or forward and back. Finger wall walks are also great. So you stand facing a wall, place your affected hand on it about an arm's length away. Use your fingers to walk up the wall as high as comfortable, keeping your shoulder down and relaxed. Hold for a few seconds, then slowly walk back down. The crossover arm stretch is another great gentle exercise. Line your back with your affected shoulder down and arm bent at 90-degree angle. Use your other arm to gently push the affected arm down towards the floor until you feel a stretch and hold it for 30 seconds. Once the pain has subsided, it's important to start strengthening exercises. So for the external rotation, hold the resistance band with both hands, keeping your elbow tucked by your side. Pull the band outward, rotating your forearm away from your body, and control the movement as you return to the start. Wall push-ups is another great one. If you stand facing a wall and place your hands on it, perform push-ups against the wall, which is a safer alternative to a traditional push-up, putting less strain on your shoulder. Then resisted rows can be another great exercise to help strengthen that rotator cuff. You want to secure a resistance band to a stable object at chest height. Pull the band toward your chest, squeezing your shoulder blades together. This strengthens the muscles in your upper back and shoulders. If you're struggling with shoulder or rotator cuff injuries, I hope this can help be a little bit more gentle. Guys, day 17 and day 18 in the gym is finished. I did a little bit of different exercises for some spots today as the machines were taken. So I swapped it for a different exercise from one of my 19 and 20 days. And I will just do that one on another day somewhere else. So yeah, see you next time. Bye.